Hello everyone, I'm Dr. Raksha, working as an Ayurvedic gynecologist and a certified yoga practitioner at Aikya Fertility and Research Center. Let's talk about role of Ayurveda and yoga in IVF treatment. Nothing is more upsetting for a patient or a gynecologist than experiencing a multiple IVF failures or a frequent pregnancy loss after IVF. And it is not an easy task to counsel couples who have made one or more attempts to keep trying over and over. But here, Ayurveda creates new hope for those couples who had IVF failure. Ayurvedic treatments are planned with medication, diet and lifestyle changes, and Panchakarma therapy. This treatment modality improves the success rate of IUI, IVF, ICSI, and as well as increases the chances of natural conception. Infertility may be due to male or female factor. Causes of infertility in women would be ovarian factor, tubal factor, age-related factors, uterine problems, PCOS, endometriosis, and so on. The menstrual cycle can be affected by many factors such as diet, emotional instability, excessive physical exercise, lifestyle, and stress, which are responsible for creating an imbalance of three doshas, which is controlling the activity of the body, that is Vata, Pitta, and Kapha. Male infertility is usually caused by problems that affect either with the sperm production or sperm transport, which would be due to varicocele infections, ejaculation problems, tumors, hormone imbalance, and etc. According to Ayurveda, any abnormal function in the body is due to Agni Mandya, that is a vitiation of the digestive fire of the body, and Tridosha Dushti, that is vitiation of the three governing factors of the body, Vata, Pitta, and Kapha. Ayurveda focuses on the treatment of infertility holistically with an aim of improving the overall health and the quality of life of the individual. Ayurvedic fertility therapies help to regulate the body's metabolism, purify reproductive organs, preserve hormonal balance, and enhances the endometrial lining and receptivity, and improves the egg and sperm efficiencies and reduces the stress. Treatment plan for infertility starts from Agni Deepana and Amapachana medications. When we talk about Ama, it is a toxin that is created in our body due to the imbalance in the Agni. When we say Agni, it is a digestive power and the metabolism which is reduced, which in turn causing imbalance in the hormones. Thereby, the treatment of Ama must always include the treatment of Agni, including the use of digestive and carminative Ayurvedic formulations, eating meals at the proper time, and following an appropriate schedule. When we talk about Ayurvedic Panchakarma therapies, the treatment help to eliminate Ama, thus corrects the Agni. Healthy Agni also helps to contribute a healthy Ojas. The next line of treatment would be Vatanulomana. The main dosha involved in infertility is Vata. So, Vatanulomana, the correcting the function of Vata, is very important in the treatment of infertility. Here, Ayurvedic formulations following a routine exercise, strict diet schedule will help in correcting the Vata dosha. The next is Shodhana, that is a detoxification therapy. Now, suitable Sneha and Svedas are done prior to Shodhana. Then the treatment modalities like Vamana, which is a vomiting therapy, Virechana, which is a loose motion therapy, Basti, which is a medicated enema therapy, and Uttara Basti, it's a special enema administered through urethral or the vaginal routes. These therapies are done as per the condition of the patient. Post procedure, the patients have to follow Peyadi Karma. That means a strict dietary regime to be followed after Shodhana. This detoxification therapy helps in the expulsion of the toxins from the body. These therapies help to correct ovarian, tubular, and uterine problems that causing infertility. Also helps in releasing the tension and removing the impurities from the body. They nourish the body, revitalize the mind, and strengthens the immune system. Therapies are beneficial in reducing stress. nourishing all dhatus of the body and pacifying vata. The next is the Ayurvedic herbs. Infertility itself does not stand alone. It is a result of some other disease. So the herbs used in the treatment are directed towards eradicating the underlying cause. Most common known and used herbs such as ashwagandha, shatavari, amalaki are extremely useful formulation which help create the synergetic hormonal balance between the follicular stimulating hormone and the luteinizing hormone. So no individual herb alone is considered useful for promoting the fertility. Therefore, a combination of herb is used in the treatment of infertility with the purpose of correcting an organic or functional problems that causes infertility. The right combination of herbs helps in regulating menstrual cycles, enhancing the general health and wellness, revitalizing the sperm, reduces stress, enhancing sleep, controlling anxiety and increasing energy level, balancing the endocrine system and improving the blood flow in the pelvic cavity, thereby promoting fertility. Few Ayurvedic herbs which are used in treatment of infertility. So when we consider the ovulation disorders, where you can use ashoka, dashamula, shatavari, aloe vera, gugulu preparations. In case of premature ovarian failure, in such conditions you can use ashoka, dashamula, shatavari, guduchi, jivanti, etc. And blocked fallopian tubes or adhesions and pelvic inflammatory disease, again the guduchi, punarnava, lashuna, etc. can be used. And in 2013, the studies that incorporating yoga into a daily life may help to lower the stress and anxiety and regulating the body functions and support sperm production. So if you want to know more about the fertility care in Bangalore, we advise getting in touch with us at Aikya Fertility and Research Center. Thank you.